Welcome to Vital Signs, where your health story matters most. Your body may already be warning you, but the real question is, are you listening? Millions of people live with undiagnosed heart failure every year, often brushing off the earliest signs as stress, age, or just being out of shape. But those tiny warning signals are your body's cry for help, and if you know how to spot them, you could save your own life or the life of someone you love. What's surprising is that these signals often start months, even years, before the condition becomes critical. Some are so subtle that most people never connect them to the heart at all. The first one appears when you try to do something simple, like climbing a single flight of stairs or walking to your mailbox. If you feel breathless doing things that once came easily, that's not just aging. When your heart isn't pumping strongly enough, your muscles aren't getting the oxygen they need, and your lungs work overtime to catch up. This is why what once felt effortless now leaves you struggling for air. People often dismiss it, thinking they're just out of shape, but when the shortness of breath creeps in slowly and keeps getting worse, it's not laziness. It's your heart signaling that it's falling behind. Medical research shows this can appear months before more obvious red flags. Another sign hides in how you sleep. At first, it might seem like you just prefer an extra pillow. But as time goes on, you notice that you can't lie flat anymore without feeling like your chest is tightening. You stack two pillows, then three, until eventually the recliner becomes your bed. This isn't a comfort issue, it's called orthopnea. And it happens when fluid begins pooling in your lungs because the heart isn't strong enough to keep blood moving upward. People often rationalize this, blaming habit or age. But if you find yourself adding pillow after pillow just to breathe at night, your body is warning you that something deeper is going on. Even more alarming is when you're jolted awake in the middle of the night, gasping for air. Imagine sleeping peacefully, only to suddenly feel like you're drowning. Your heart is racing. You sit up or rush to an open window, desperate to breathe. This terrifying experience is called paroxysmal nocturnal dyspnea. It happens because while you lie down, the fluid that collected in your legs during the day redistributes into your chest, overwhelming a weakened heart. Many people mistake it for a nightmare, stress, or sleep apnea. But if it keeps happening, well, it's a sign that your heart cannot handle the extra fluid and it needs immediate attention. Fatigue is another symptom that most people ignore. We all get tired, but this is different. This is exhaustion that never really goes away. You wake up tired, daily tasks feel overwhelming, and even showering can feel like work. It's not that you're lazy, your body is simply rationing energy. When the heart can't pump enough blood, it prioritizes vital organs like the brain, leaving your muscles starved of oxygen. This creates a constant feeling of weakness and steals your ability to recover after activity. What once gave you energy now leaves you drained. People often blame age, but this level of fatigue isn't normal. It's your heart telling you that it's running on empty. The next sign is one you can actually see: swelling in your ankles, feet, or legs. At first, it looks like puffiness or socks leaving deeper marks than usual. But as days pass, the swelling worsens, becoming more noticeable by evening. This isn't just standing too long. It's fluid retention caused by poor circulation in the kidneys holding on to extra salt and water. The swelling usually shows up symmetrically on both sides, creeping upward if left unchecked. Press on the skin, and the indentation remains for seconds. That's fluid buildup. Many people shrug it off, but it's one of the body's most visible warnings that the heart is struggling. Sometimes, the warning shows up on the scale before you even notice swelling. If you suddenly gain 2 or 3 pounds overnight, or 5 pounds in a week, that's not fat. That's fluid. Each liter of retained fluid equals about 2 pounds, and when the heart weakens, the body holds on to it. Doctors even tell patients with known heart problems to weigh themselves daily for this reason. Rapid, unexplained weight gain is a measurable and critical red flag. If the scale is moving upward without explanation, your body is telling you something urgent. Don't ignore it. Another overlooked symptom is waking up multiple times at night to use the bathroom. You might think it's just drinking too much water before bed, but what's really happening is fluid redistribution. During the day, gravity pulls excess fluid into your legs. At night, when you lie flat, that fluid finally returns to circulation and your kidneys are suddenly flooded. The result? Frequent urination, often 3 to 4 times a night with larger volumes than usual. It's called nocturia, and while many people laugh it off as a normal part of aging, it can actually be one of the earliest signs of heart failure. There's also a persistent nighttime cough that shows up only when lying down. It's not the kind of cough that clears with tea or allergy meds. Instead, it's a nagging, dry cough that may even bring up a little frothy, pink-tinged mucus, a sign of fluid touching the lungs. Often, it improves when sitting upright but returns when lying down again. Many dismiss it as post-nasal drip or seasonal allergies, but when it only appears at night, especially if paired with wheezing, it's often linked to the heart, and ignoring it can be dangerous. Then there are the palpitations, that unsettling feeling when your heart suddenly skips, races, or pounds against your chest. Some describe it as fluttering, others as if the heart is doing somersaults. These sensations often show up when the heart is struggling to keep up, leading to irregular rhythms. Atrial fibrillation, one of the most common irregular rhythms, is both a cause and a result of heart failure. This cycle can spiral quickly if not addressed. While palpitations can stem from anxiety, dizziness and near fainting are another critical signal. When the heart can't pump enough blood to keep steady circulation to the brain, the result is lightheadedness. You may feel woozy when standing, exerting yourself, or even randomly throughout the day. Some experience blackouts. People often blame dehydration, inner ear problems, or even medication side effects. But if these dizzy spells come alongside fatigue, shortness of breath, or swelling, the pattern points to something much deeper. Heart failure also reveals itself through the digestive system. Imagine eating just a few bites and feeling uncomfortably full, or dealing with persistent bloating that never really goes away. This happens because fluid builds up in the abdomen and the liver becomes congested. Blood isn't flowing smoothly, so digestion slows. People sometimes report nausea or pressure in the upper right side of the stomach. These symptoms can be brushed off as indigestion or minor stomach issues, but in reality, they are often tied to one of the strangest and most specific signs is called bendopnea. Have you ever bent forward to tie your shoes or pick something up only to feel like you can't breathe? If it happens within 30 seconds of bending, that's bendopnea. It was only recognized by researchers about a decade ago, but it's now seen as a highly reliable sign of advanced heart trouble. Most healthy people never experience this, so if you notice shortness of breath when bending over, it's a red flag that shouldn't be ignored. Finally, there are the circulation changes you can feel in your hands and feet. If they're always cold, even in warm weather, or if your nails take on a bluish tint, it's because the body is directing blood away from the extremities to protect vital organs. This is your body's survival instinct, but it's also proof that your heart isn't pushing enough blood with each beat. Sometimes, doctors notice it through a narrow pulse pressure, the difference between the top and bottom numbers in a blood pressure reading, but you may notice it simply by touch, hands and feet that never warm up no matter how many blankets you use. If you've recognized yourself or someone you care about in these warning signs, don't panic, but don't ignore them either. Heart failure is serious, but catching it early makes an incredible difference. Modern medicine has advanced treatments from medications that strengthen the heart to lifestyle changes that can slow or even reverse the disease's progression. What matters most is awareness. Too often, people chalk up these symptoms to aging or stress. But when several appear together, the picture becomes clear. The heart is struggling, and it's time to act. Have you ever noticed any of these signs in yourself or someone close to you? If you have, consider this your push to take it seriously. Don't wait until it's too late. Early detection can protect years of your life. If this video was helpful, type helpful in the comments. It motivates us to keep creating more content like this. And of course, don't forget to like, share, and subscribe to Vital Signs for more life-saving health insights. Thank you for watching and for taking charge of your heart.